Hi, everybody. Thanks again for joining. It looks like our presenters are here. So when they are ready, we are going to get started. I'd like to welcome Allison Blum and Alex Pattinson. They are both outpatient therapists here at Lenape, and they are going to be hosting our workshop today. And thank you all for joining us.
Hi, everyone. We're really glad to have you. This is actually our second time doing a virtual workshop. So we're still getting used to it and working out kinks. So please bear with us if anything were to kind of, if we were to have any hiccups along the way. But this workshop is focusing on ADHD, which is attention deficit hyperactivity disorder. If you guys probably have already noticed, you joined muted, and we do ask that you remain muted for the majority of the presentation. There will be times throughout the presentation that we'll invite you to unmute yourself so that you can participate. There will be time for questions. There's also a chat function in the Zoom. So if you would if anything's coming up for you while we're speaking and you don't want to forget or you want to ask the question, please feel free to do so in the chat because we will be checking that as well. Also, later on in our presentation, we will be joined by Dr. Umadevi Nuthi, and she is our child and adolescent psychiatrist at Lenape, and she'll be focusing a little bit more on the causes of ADHD and the brain and medication and stuff like that. But Alex and I are going to get us started. So I always like to start with this slide. So I do apologize if you've attended before to one of our workshops because this is going to sound familiar. But before I meet with a client, I always give like a little spiel on what they can expect from therapy and anything that is legal, including limits of confidentiality. So I do want to start today with my spiel for you guys, just for anyone who is has a child in treatment or is considering having a child in treatment. I always like to let people know that the age of consent in the state of Pennsylvania is 14 years old. So what that means is at the age of 14, that kids can consent to their own mental health treatment and can also consent to who is involved in their treatment and who gets the information about their treatment. So what that means basically is if you have a 14-year-old child in treatment and you want to know how it's going, they have to sign a release of information in order for the therapist to be able to share that with you. And so, of course, as therapists, we do encourage the children, teenagers, to sign releases so that we can talk to parents. But I just wanted to make everyone aware that that is a thing. Also, there is a limit of confidentiality, of course. So if there is any kind of suspected child abuse or neglect, or the child or teen is a danger to themselves or a danger to others, of course, we are going to be informing you, the parent caregiver, of that kind of thing. So these next couple slides are highlighting the symptoms and characteristics of attention deficit hyperactivity disorder. So these are things that you will be seeing or are seeing in your kids and teens. So there are 3 different types of attention deficit hyperactivity disorder. The first type is the inattentive type. So this is the type where you're going to see that they fail to give close attention to details sometimes. They may make careless mistakes, they overlook details, and their work may be inaccurate. So it kind of looks like they're glazing over things or just rushing through things to get them done. They have difficulty sustaining attention and difficulty focusing. They don't seem to be listening when they're spoken to directly, and their mind may seem elsewhere. They often don't follow through on instructions or directions. They may fail to finish schoolwork, chores, or duties, and they often have difficulty organizing tasks and activities. Another thing you may see with these kids is that they often avoid or dislike or are reluctant to engage in tasks that require sustained mental effort. So when you have a kid with ADHD and you're like, wow, you were just on Fortnite for 3 hours. You can do that, but you can't do your math homework for 30 minutes. This is why. The math homework is requiring sustained mental effort, whereas maybe the Fortnite is not so much. They may often lose things. They're easily distracted, and they are often forgetful in daily activities such as chores, writing down homework assignments, and even hygiene. So this is why, and we'll get to this a little bit later, lists can be really helpful and important. The second type is the hyperactive impulsive type of ADHD. And this one you can literally see. These are the kids that are fidgeting, tapping, squirming, leaving their seat in situations when remaining seated is expected, such as a classroom or an assembly or a movie or something like that. These kids will run or climb in situations when it's inappropriate. They're unable to play or engage in leisure activities quietly. They're on the go, acting as if driven by a motor. They could talk excessively. They may blurt out answers or responses. They have trouble waiting their turn, and they often interrupt or intrude. The third type is actually a combined type. So the third type is kids who show the inattentive symptoms as well as the hyperactive impulsive symptoms. Now, as children get older into their teen years and sometimes even into adult years, if the ADHD remains, then what tends to happen is you see less of the hyperactive impulsive symptoms, and it's predominantly more of the inattentive symptoms that you see. So there are some things that come along with the diagnosis of ADHD, one of them being a negative stigma. So sometimes these kids are labeled as troublemakers or the problem child, and that can lead to other things. So sometimes when you see a kid with ADHD, you may also see some depression. They're sad that they can't meet the expectations of others, that they are having trouble making friends. You may also see anxiety. They may get worried about going to school because they're just not doing well there, and they get in trouble there. You could see conduct disorder, not so much in the little ones, but more of the teens. Conduct disorder is kind of a more developed form of oppositional defiant disorder, which is what you see in more of the younger kids. And that develops when these kids are repeatedly not able to meet expectations, and they get really discouraged, and then they just get to a point where they're like, well, I'm just going to do me because I can't do this. So then you start seeing the defiant behaviors. They're not following the rules. They're not even trying because they feel like it's not worth it. Another thing that can come along is learning disabilities. These kids are having a really hard time focusing and retaining information, and so they can be behind in their learning. Sometimes substance use or abuse can evolve in teen years. They may use drugs and alcohol to help them cope. They may use drugs and alcohol because it helps them to calm down. It might help them slow down. It might help them feel better. You also see, and I kind of touched on this with the labels, is that kids can then develop low self-esteem. They just don't feel good about themselves. They feel like they're a problem. They're in trouble when they're in school, they're in trouble when they're at home, and they really are struggling to make friends and socialize in an appropriate way. Another thing that you can see with ADHD is something called rejection sensitive dysphoria. So this is an extreme emotional sensitivity and pain triggered by the perception that a person has rejected them. They may also be triggered by a sense of falling short and disappointing others. So what happens is these kids are constantly feeling like they're just disappointing other people, and then they're feeling like they're being rejected by others.
Yeah, I see. I'm Alex, by the way, another outpatient therapist. Hi, everybody. I do see this a lot in adults now who maybe didn't have the proper guidance or care when they were kids. So as we all know, we get constructive criticism sometimes, but a lot of times children with ADHD, they're so used to being criticized all the time that when maybe someone does give them any kind of criticism or constructive criticism, they become very sensitive and they could easily react and feel very rejected over maybe anything because they were just so used to it. So this is why it's so important to raise awareness for ADHD so we can work on that.
So this story, it's called My Whirling Twirling Motor. It's a really interesting and adorable story about a child with ADHD and basically what life is like for him on a daily basis. And Alex is actually going to read this and share this with us today.
So I read this to a lot of my youngsters. So forgive me, I know you all are adults here, but I probably will end up reading this like I'm reading it to children. But so I'm going to read the whole story because I think it gives good insight to a kid's mind. It's very short, so bear with me. I'm going to try to show you, but it's more important with the words. So again, this is called My Whirling Twirling Motor. Hurry, we're late for school. I have a spinning motor inside me that buzzes and whirls and hums. I can't turn it off. It made me play with my dinosaurs instead of getting my shoes on this morning. At school, my motor made me wiggle too much during story time. I touched the teacher's scissors and I talked out of turn, whirling, spinning, humming. At recess, my friends wouldn't play with me because my buzzing motor noises were too annoying. So I threw a ball hard and hit Nicole in the face by mistake. Ouch. Sorry, Nicole. The twirling and humming made me forget my snack and my lunch and my homework. At home, the motor ran fast around the dining room table, running and running and running, round and round. Mom told me to slow down, take it easy, but I couldn't turn off the motor. So Dad had me sit down and plunked a box of blocks in front of me. Up, up, and up. I kept going higher and higher. Time for dinner. It made a tower, so high it almost hit the ceiling. Charlie, dinner now. Mom and Dad came to get me. They had mad faces. Now it's time for bed. Dad chases me twice around the sofa. Mom tells me to brush my teeth. Bedtime. But I can't sleep. I have a spinning motor inside me that buzzes and whirls and hums. Mom tucks me in and I squiggle and squirm because the motor is busy. Hey there, little worm. I know it's hard for you to settle down. You always move, move, and move, but I need to talk to you. Uh-oh, will she tell me all the things I did because of my buzzing motor? I bury my head under the blanket. I wish I could turn off the motor. She takes out a sparkly red notebook and reads from the list. The wonderful list. You took your cereal bowl to the sink without being asked. Said thank you. Your teacher said you sat still during spelling. You finished your math. You shared your markers. You ate all your peas and broccoli. You put your blocks away. You got in your jammies for Dad much quicker today. You brushed your teeth for the first time I told you to. And I'm very proud of you. My buzzing, twirling, humming motor settles to a quiet purr, and a warm, cozy yumminess spreads. I like this feeling. Mom ruffles my hair. You did all that today. I wrote it all down to remind us how wonderful you are. I bet I'll catch you doing all sorts of wonderful things tomorrow. I dig down into my warm covers. I guess my motor is a little sleepy after all. Dad says goodnight. Mom kisses my forehead. They think I'm wonderful. What will be on my wonderful list tomorrow? So I love this story for a couple different reasons. One, just from the kid's perspective, just shows that it's really hard to turn that motor off. And I also loved it the way the story ended with the parents reading the wonderful list. Charlie, the story, the character, he was expecting something else, but he got the wonderful list. He's used to people not wanting to play with him at recess, for getting several verbal prompts, for telling him to sit still, for getting in trouble for forgetting his homework. Seemed like he was kind of surprised to get that wonderful list, and it made him feel good. So a lot of what Alice and I will talk about today is how interventions to give children, and one of those things is remembering the wonderful things they do. Which brings me to this, caring for a child with ADHD. So I'm going to talk about the 5 C's parenting approach model. And this model was written about in this book here titled What Your Child with ADHD Wishes You Knew. And this book is written by Sharon Saline. And the 5 C's has 5 words in it. So it's self-control, compassion, collaboration, consistency, and celebration. So first, self-control. This is really important for all caregivers, parents, teachers. I'm sure if you know someone with ADHD, it can be frustrating. We can lose our temper, we can get angry, especially if we're not being heard, we're not being listened to. So first and foremost, it's important to learn our own ways to regulate our emotions, to learn self-control. This is also especially important because the children we work with and we care for, they learn from us. We need to teach them how to regulate our emotions and show some self-control. And again, I know this is hard to do, especially when you're yelling for your kid to come for dinner for the 10th time. Just breathe is what I always say. It's important to learn skill to help you respond rather than react. So the next one is compassion. Just as frustrating as it is for a child, for you to deal with someone who is not listening, who's forgetting everything, it's just as frustrating for the child. So it's important to show compassion. Meet the child where they are. They might not be where we want them to be, but it's important to remember that we have to meet them where they are. Next is collaboration. This is super important. It's hard to do all of this alone. Collaborate with others, collaborate with teachers, counselors, coaches. Let's say your son joins a football team. It's important to collaborate with the coach. They should understand why it's hard for them to follow instructions, that it may take a little bit more repetition, that they might need an extra verbal prompt, or they might need a little extra, encouragement or support. If you're not sure how to handle a situation, collaborate with the teacher or the counselor who might know. It's important to know you're not alone and to collaborate for others for the best interests of the child. Consistency. This is important. Children with ADHD can forget. We're going to have to teach them a bunch of different interventions. It's important we stay consistent with it. That can be hard. We can become frustrated ourselves, but consistency will help them learn. And lastly, celebration. This is the fun part. A child with ADHD, like I mentioned, they're so used to being criticized. Oh, you forgot your homework again. I had to tell you 10 times to come up for dinner. Oh, they don't want to play with you because you talk too much. Remember to celebrate the victories, even ones that would be deemed as small. This will help their self-esteem, and it's so important. Just some other tips too for caring with a child with ADHD. Self-care. So this is emotionally and physically exhausting. Make sure to take care of yourself. You need time. You can't pour from an empty cup. You got to make sure you take time to take care for yourself. And also choose your battles. There's going to be a lot of them. And remembering it's not all their fault. So pick and choose your battles, take your time, and just breathe.
So Alex and I thought it would be good to touch on some of the challenges that caregivers, teachers, counselors are facing when working with or parenting, raising a child with ADHD and COVID-19. So at this time, we'd like to invite you, if anyone would like to share some of the challenges that they've noticed in working with kids with ADHD in relation to the pandemic, please feel free to share anything that you would like, any challenges that you're experiencing.
I would say virtual learning.
Yes, absolutely.
Biggest one, that's why I'm here.
Yes. Yes, I'm glad you brought it up. So what's the biggest challenge for you with the virtual learning?
My husband and I both work full time, and we tried virtual learning. We actually ended up switching him to 5-day, despite a lot of reservations, just because he needed redirected so many times because it's a screen and he's sitting and looking at a screen all day. And it's just so hard for him to just stay focused on that one screen. And so I was finding by noon, he was melting down every day.
Oh yeah.
It was not a pretty sight. So anything that we can do to bolster that online experience. I think my child's also very social, so I think the online does not give him any of the socialization that he's looking for.
You are hitting all of our points. That's our next one.
Yeah, so we've found ways around that. We're allowing more electronics, and we're allowing them to like chat with their friends while they're playing electronics, and we're doing outside scooter play dates and stuff like that. But it's, to be honest, the online learning, I have not found a good way to make it work, and I'm concerned. I understand it, but I'm concerned that we're going to go back to online learning with the way COVID's going. And to be honest, it was bad. So like he lost weight, his anxiety kicked in. So I would love to have a more productive online learning experience. That's what I would love to learn.
Yeah. Thank you so much for sharing.
Sure.
Did anyone else have any challenges that they're facing that they wanted to share?
Yeah. My grandson, he lives in about 20 minutes from me, and it's the opposite. When I heard he was in school part-time, and then they decided to close and have all virtual learning. And when I heard that he said that he prefers virtual learning, a lot of bells and whistles went off in my head, because one of his challenges is socialization. He talks a lot and he's not popular, although it breaks my heart when I see him in a group and he wants to, but he don't know how. He doesn't know how to interact with a group. He doesn't know how to play nice. So virtual learning is, I don't know. Maybe we'll see when my son gets backed up at work and he comes here and we can see what's going on with the virtual learning. But from what I hear, he seems to be doing okay. He likes it. He has his iPad and earphones, and I don't know. It's still
so different. It's just so different. Yeah.
It's heart-wrenching. When he got diagnosed and he takes some form of medication, like one of those amphetamines for kids. I don't know which one, but I don't know if that's, I wish I had more control and I was more involved. I would send him more to specialists instead of being treated by, my son decided he trusted his general practitioner to treat him, and I'm talking too much. Thanks.
I appreciate it. Thank you. Because it's true. Like, these are all challenges, and COVID is just adding to them.
Yeah.
I have a comment in the chat as well, Allison.
Oh, great. My middle school daughter has surprised us by doing an excellent job with virtual learning, but I think she uses all of her energy to be successful online and has no motivation or energy for the rest of the day. Being with peers definitely helps both motivation and energy, but it's not possible every day. And that is also very true. Very true. Because a lot of the times, and correct me if I'm wrong, everyone, but what we see is these kids do use up all their energy so that they can stay focused in school, so that they can get their work done, so that they can do these things. And then they're either exhausted when they're done and then they're cranky, or they've tried so hard to contain it all day that they're just a whirlwind when they get home, and they're into everything and they're doing everything, and they're just this explosion of energy. And I'm saying get home, but like if you're doing the online learning, it's probably the same kind of thing. So yeah, that definitely happens. With the online learning and kids with ADHD, I have to say, one of the things that I've seen that has been the most helpful are the teachers. They are just so wonderful at like engaging these kids. They're like super high energy. I think they're doing such an amazing job of like trying to keep these kids engaged during the classes. And I just give them so much credit too for everything that they've been trying to do. Breaks help. Some of the kiddos that I talk to, they'll like take little breaks here and there. I have a kid actually right now that what she does is she sets an alarm on her phone so that it vibrates every 10 minutes and it kind of reminds her to refocus. So that's just a couple of the things that I've heard from other people that they're trying, but it is just such a challenge.
And some teams put like post-it notes a few times around their computer saying stay focused, pay attention, or if they have things they need to do, write their task on the post-it, and then each time it's done, they take it, the post-it off, and then they can throw it away. But that way it's like a visual reminder, you need to do this. Or even ones like take breaks or you got this, keep going. And at the end of the day, they can take it off and put a new one up. Just little things like that I found be helpful. And even just like checking in with just your body. Did I eat enough? Did they drink enough water? Just that those things can make a difference with focus too.
My son is in sixth grade and he's hybrid. So he's 3 days virtual, then 2 days in person. And he's starting to kind of step back and not want to go in person because the in-person that we all knew and were familiar with, it's not like that. So it's almost, you know, it's like, it's just not that refreshing, like, oh, I'm going to see my friends and, you know, blah, blah, blah. But academically, it's so much better for him because we had that parent-teacher conference and she's like, oh, when he's here, he's up front and I'm tapping. So it's good academically, but socially, it's very frustrating and almost like upsetting. And then online, he has created so many different ways to be the class clown. I mean, I was amazed at how many different ways he could do it. And I'm right there with you. Like, God bless these teachers who are redirecting, correcting, and still educating them. So I'm afraid, honestly, I mean, I know there's so much undoing we're going to have to do after this, but all these different habits that they're developing, that's what scares me the most.
Mm-hmm. That's a
If
great
I can, oh, I'm so sorry. If I can kind of chime in, I actually work as a teacher and I see a lot of students with ADHD who are going through so many different struggles. And Katie, I can totally understand like where you're coming from. And the one thing that teachers do worry about as well is, are we going to have to backtrack back to our regular normal after the pandemic is over? And what myself, along with I think a lot of teachers are trying to do is, especially if we've already spent a year or so with the student, is figure out ways that work for them and try and incorporate their regular habits pre-pandemic into how we can keep them focused during class or how we can keep them doing homework after class is over and kind of how we can support them. So I do think a lot of teachers are trying to, for lack of better terms, mush together some of their previous habits with their current new ones, but consistency has really just been a lifesaver, and I think a big thing for a lot of these students is time management.
Thank you. That is so true. Ray, you're muted if you want to unmute yourself.
If I was reading Katie right, my perception is that the in-school experience is completely changed and it's not as fun. They're separated. There might be rules about they're not allowed to touch each other, and there's no more gym class, no rolling around, no messing around. So I think that, I don't know if Stephanie can speak to that, whether that's her experience within class, whether there's strict rules about separation, 6 feet, and don't touch, don't shake hands, or.
Yeah, oh, absolutely. I actually work with high school level students for ages about 15 to 18. And even in their teenage years, we always tell them, I work in a career and technical education school, so we work a lot with hands-on activities in addition to theory work, and it's hard when you have to keep them socially distanced and 6 feet. And one thing we are seeing is actually we don't have a lot of issues with the kids keeping their masks on. They've tend to now grow into that habit, which is a good thing. But yeah, socially distance is hard. Usually the first thing they would love to do is socialize with their friends in the morning, and we have to say, guys, come on, get to your seats. So that it is a different experience, absolutely.
Thank you so much for giving us that perspective of like what it's kind of like to be in there in the school. Appreciate that.
Of course.
The last point that we have that was also touched on was a decrease in activity. So yeah, there is not as much for these kids to do. And it's just a lot harder for them to be active. And like some of these kids just need to blow it off. And it's really difficult for them to be able to do that with social distancing and everything else that's going on with COVID. Did anyone else have any other comments they wanted to make before we move on to the next slide?
I'll try not to talk so much, I promise.
You're fine. I love it. Great.
I did just want to point out, if there are any students that are struggling from a virtual perspective, one thing that I have found that helps them is most students will find a certain spot in their house that they will work at, whether it's at their own desk, or a lot of students will want to just sit up in bed. And we always encourage these students to not sit in bed, not lay down, because of course it makes them tired. They associate their bed with sleeping rather than work. So if there is an area in the house, we always suggest, hey, like maybe do this at your kitchen table. If they're in a position within their house in a common area where they may have siblings running past them, or any parents or pets running by, and they do get easily distracted, I always suggest them that they turn and face a wall that way, and have headphones in if they want to listen to music. That way they're not so inclined to have all these visual distractions in their line of sight. If I do have students that are just totally bored half to death, sitting there staring at a screen, and we usually ask them to keep their camera on, we always suggest, hey, maybe just stand up, give yourself a stretch, walk around your kitchen table a few times, go say hi to your dog, like go do something motivating and active. And then by the time they get back after a minute or two, and usually we'll have them do something on camera so we can make sure they come back to the to the computer. That always kind of helps motivate them to get back into an activity.
Thank you so much for that. I actually wrote them down. Thank you.
You're welcome.
So ADHD does not only affect the child who is diagnosed with that, but that does affect the entire family, the entire household. Alex touched on a bit of this in her when she was explaining the 5 C's. And one thing is that it is exhausting. It can be very frustrating to be parenting a child with ADHD. And so again, it is very important for you as parents, caregivers, teachers to keep up with self-care so that you are able to have that level of patience that you need in order to be effective with these kids. One thing with these kids is they require a lot of attention. They're not the kind of kid that you can say, okay, do your homework, and they sit down at the table and you can walk away for a half hour and they'd be there. They would, within 10 minutes, they're doing something else, or they aren't even at the table anymore. Maybe they're watching TV. Maybe they are petting the dog. They're getting a snack. They are up in their room. They decided they wanted to change, the shirt they were wearing, whatever it might be. So it requires a lot of attention then from the other people in the household, the parents, caregivers, to be able to keep that person on task. And then that can also, result in attention not being given to maybe some of the other kids in the house that can stay on task and can do what they're being asked after one or two requests. So it's really important to kind of monitor that. But again, to be able to give that level of attention that's required, you're going to need to take care of yourself too. Another thing that could happen is with the frustrations and stressors, there could be conflict just within the caregivers themselves or the parents. Maybe one parent wants to handle it one way and another parent wants to handle it another way. And then tension between the parents can cause tension in the household. And then everybody's tense and on edge. So it's just good to be mindful of all these things and being taking care of yourself, communicating with your partner and whoever else is involved, the collaboration piece, just to make sure everybody's on the same page as you're trying to take care of these kiddos. So there are a number of different treatments for ADHD, and Ray had mentioned medication, which is certainly one of them. Dr. Nuthi will be joining us in just a little while, and she's going to elaborate on that. But while we're here, we're going to discuss the therapy piece. So you can do individual therapy, family therapy. There are different levels of care. So sometimes with ADHD, you might see kids get what's called wraparound services, which is when they actually go out into the home and meet with the kids directly rather than having them come into an office, which is what like Alex and I would do with outpatient. But the two different kinds of therapy that can be pretty effective with ADHD are behavioral therapy and cognitive therapy. So with the behavioral therapy, it can help the child control aggression, improve social behavior, and be more productive. And it can also give parents skills. For example, one of them being like giving instructions one at a time instead of trying to give like, okay, make sure you take out the trash and do your homework and get ready for bed by 9 o'clock. Saying, okay, go take out the trash. Great, good. All right, you did that? All right, let's finish your homework. Okay, great, good. You did that? All right, let's get ready for bed. One task at a time is much better for the kiddos with ADHD. Cognitive therapy can help a child improve their self-esteem, reduce negative thoughts, and improve problem solving. And then, of course, lastly is support from family, peers, and outside sources and having a positive attitude, which is something we've been discussing. Some interventions that you could try. It's really important to have routine and structure, and we do the best we can, right? Especially with everything changing, at the drop of a hat here and there. So one of the things with ADHD kids, as far as routine and structure that could be helpful is lists. So making like lists of different tasks and then maybe putting them around the house. I, for example, had a family that used to make a list for the morning routine, and they would put it in the kids' bedroom. And then they would have a list for their afternoon routine and put it on the refrigerator in the kitchen. And then they had a list for the evening routine and they put it in the bathroom. And so then when the kid comes downstairs, after the morning routine, the parent can say, did you do everything on your list? So it's a reference point for the kids. It's a visual way for them to see what they have to do. So that's easier for them to remember. All they have to do is remember to look at the list. And then it's easier for the parents too, because they're not going, did you do this, that, this, this, this? You can just say, did you check your list? So it's just one point of reference. Another thing with kids is setting alarms. So if you say they get done school at 3 o'clock and they are supposed to, walk the dog and take out the trash, but you like to give them a little bit of downtime after. So you say, okay, have an hour, set an alarm on your phone or set an alarm, parents, on your phones. So at 4 o'clock when the alarm sounds, it's time to take out the trash, or, it's time to walk the dog, or, it's time to do whatever it was that I was supposed to be doing. So just like little reminders in that way. And then, as I mentioned before, giving instructions one at a time can be really helpful.
So I'm just going to talk about exercise and body movement. I'm I'm sure we all know that exercise has many benefits. It's super important for our physical and mental well-being. But exercise can also help with clarity and focus and motivation. When we exercise, we release endorphins, one of them including dopamine, which helps with this positive feeling. So with ADHD, one could experience sadness and depression and anxiety, especially now during the pandemic. So exercise is all that much more important. The research I've read shows at least 30 minutes a day can be helpful. You know, especially with children in school, they're really encouraged to sit still, pay attention, so they could be around. So especially when they come home, it's so important for them to release that. So it's so important for them to find some kind of body movement or exercise or activity that they like. Specifically like aerobics or cardio is especially important as well. So that being said, it's important they find some kind of cardio that they actually like though, because they could easily get bored or discouraged. So they really need to enjoy it. And also important to find an activity that they like, because like a competitive sport or a team sport can be especially discouraging because of the instructions, the list, the rules. It could be a lot. That is by no means saying they couldn't do it. They certainly can. But I certainly don't encourage pushing them for a team unless it's something they are desiring. Because of that, for a lot of my own clients, it's been a source of embarrassment if they're forced to do like something like football, where all these plays and these lines, and if they can't keep up. So I did write a list of some things that I read, some more individualized sports that could be beneficial. So like hiking, skiing, canoeing, track, surfing, skateboarding. These are all things that, you know, are really active, but things that aren't as competitive. And again, it doesn't mean they can, but it's just important to consider all options and to get creative. We want them to really enjoy it and to look forward to doing it because it can be so helpful. So I'm also going to talk about validation and compassion. So I know I touched on this during my 5 C's talk, but just validation is so important. Typically, Alice and I would role play what validation would look like. For time's sake, I don't think we're going to get there today. If we do have time, we'll get to it. The previous workshop we did on anxiety, which is posted on our site, we do have a role play where we role play. I was the child, Allison was the parent of validation. But what that looks like is just, you know, showing compassion for what they're going through. You know, if they're like, oh, this isn't fair that it takes me longer to do my homework, saying something like, don't worry about it, just do it. Maybe go for it a little bit like, I know it's really hard, and I know it's harder for you, and that must be really frustrating. I know you have to do it anyway, but it's really hard. So although I'm not letting them get out of it, but what I'm simply doing is I am acknowledging it is hard. It's not fair. And you do have to work hard in some ways. And, you know, in some ways that can be our ADHD superpowers, what I tell some of the kids I work with, but I'm not dismissing that it's hard, because it is. And giving positive feedback, again, I know I touched on that earlier, but I just can't stress the importance of that. I know it was really hard for you to do your homework today, but hey, thanks so much for listening when I asked you the first time to put your toy away. That was really important. Just so important, because they're going to hear that criticism quite often, not only from the adults in their life, but from peers, maybe from talking too much or butting in front of line. So just making sure you're acknowledging the good stuff too. It's very important.
So the last thing that you can be doing at home is, of course, just modeling behavior. So you are displaying the behaviors that you want to see your children doing. And, you know, the children, they're like little sponges. They're going to take it all in. And if you're acting one way, they're going to learn from that. So making sure that you are, again, kind of managing your own emotions, self-regulation. If you yourself have ADHD and you're caring for a child with ADHD, make sure that you're taking care of your own. You know, finding like tricks and tools that work for you to manage your symptoms and be able to stay on task. And just showing your child how to best do that. Because they really do, that you are the models for them. And they will behave like you. So we're going to take some time now to do a behavior chart or reward chart. This is one of the tools that we use to help to encourage behaviors. I like to use in my behavior charts things, behaviors that I want to see rather than behaviors I don't want to see. I just find that that's easier to work with, and it just seems to get more results. So when you make a behavior chart, the important thing is that you want to follow it. You want it to be consistent. It really is not going to be very effective if you're not following through and being having like the same consistency with it. So the point of it is that you have these behaviors and then you mark off when they do the behaviors. And if they do it a certain amount of times in a week, they can earn something. And you want to make sure that this is obtainable for the kids. So all that being said, I'm going to shift around a little bit here. See, so you guys can see my chalkboard. Okay. Feel free to unmute yourself again. And if you would like to give me a task or behavior that you would like to see in your child to put on our behavior chart.
Clean your room. Brush your teeth. I could keep going.
Give me one more.
Do your chores independently. To empty the dishwasher.
There you go. I hope you guys can see this okay, but there's like little squares now that I've made. And so across the top, you would want to put like the day of the week. So say the child, you know, he cleans his room Monday and Wednesday, and he did good brushing his teeth. He did that every day. But he really only emptied the dishwasher on Tuesday. So the point of this now, and you can do this anyway, you can do stars or smiley faces or stickers or however you want to mark your behavior chart. But the point now is, okay, what was the goal? So maybe if you're doing this on like a 7-day week and they get a reward at the end of the week, then you want to make sure that they get 3 stars in each category. And if they can get 3 stars in each category, so that's 3 out of the 7 days they did these things, then they can get their reward. Maybe you make it 5, but what you want to do is you want to make the goal attainable. So you don't want to have too many behaviors here because that would be overwhelming. And you don't want to make the time frame too long. A month would be overwhelming, right? Like that's a long time to really behave and focus in order to get a reward. So what you can do is, as they start to get better and start to earn the rewards consistently, then you can make it, okay, let's see if you can get this many stars. Or, okay, let's see if we can do this over 10 days instead of 7 days. And you can stretch it a little bit so that you're kind of like, okay, we accomplished this goal, then we can move on to this goal. And then you can also change the behaviors as they start to master those. I will say, clean room is a great one. A kid with ADHD is not going to be able to do that because cleaning their room means what? Making their bed, picking up all their toys, folding their laundry, putting it away. So you see how that happens. It's like, oh my gosh, we think of it as one task. They think of it as 15. So that's where it's like, it can get a little bit hairy with the behavior charts and you kind of have to pick and choose. Kind of like what Alex was saying is like far as choose your battles. It's almost like, okay, let's choose what we want to focus on first. And once we've mastered that, we can move on. And then the rewards, they can really be whatever you feel comfortable with. you could do something where they earn like a little toy or a candy or an ice cream or Roblox bucks or a gift card, whatever it is that they may want. But another thing that I find has been very effective and kids totally buy into it is attention. You know, watching a movie with mom and having popcorn or taking a walk with mom or dad, washing the car with dad, having a dinner date, some stuff like that where they're actually spending like quality time can be very effective as well. But the main thing with the behavior chart is you want them to succeed, because then they buy into it. If they can't succeed at it, it's not going to be effective.
The kids I work with, I know they like to make their own too. So this could be like a fun family activity. It's just
very true.
They can pick out their color of their chart, pick out the stickers. It just gives a little bit more motivation depending on the age for them to want to do it too. So we figured we couldn't talk about ADHD without talking about fidgets. Definitely thinking about all the teachers for this one, especially the picture in the background. I'm sure everyone remembers the fidget spinner. The purpose of fidgets is it's a help as a distraction, but it really helps the child with ADHD stay focused, and they really can be effective. It's really important to find the right fidget though. The fidget spinner was fun, but a huge distraction. I can't tell you when they were really popular how many kids I work with got in trouble for their fidget spinners. And we certainly don't want them getting in any more trouble. So some things that I found helpful, some feedback I got from some of the kids I work with, I will have them make bracelets that don't really make any noise. So, and I'm not wearing one now, but if you make them with like beads, they can just kind of twirl the beads on their hands quietly. No one has to know they're doing it. It can be under their desk, and it can just help them stay focused. I've had kids with like small stones like that or pebbles that feel smooth, and just have them in their pocket. And I always give instructions, make sure this is not a distraction. This can't be used, can't be passed around in class. Even sometimes doodling, this one can get tricky because sometimes a child could take advantage of it and start really drawing, but sometimes sketching or doodling on a corner of a paper can be helpful. I noticed, just as a therapist, when the children or teens I'm working with who have ADHD, if they have something in their hand or they're doodling a little bit, I get so much more conversation. When I first started therapy, I was like, why aren't they paying attention to me, or why aren't they engaging? Or I'd get frustrated. I'm like, they're doodling in the middle of session, but I now know that it is super helpful. Even having like a blanket on my sofa they sit on for therapy, them touching that gives them so much more focus. So it's hard to find the right one. I definitely don't recommend the fidget spinner. I think that was just a fun toy for them, but there are certain things, even things like a necklace, having something to hold on to and just like feel, using your senses can be really helpful.
Dr. Newthy is with us now, but does anyone have any questions before we move on to Dr. Newthy's piece? Okay. Dr. Newthy, are you there?
Sorry, I had to unmute myself.
Oh, no problem.
Okay, I'm ready to go.
Yep.
Hello, everyone. Just wanted to wait, how do I move this along? Oh, I'm sorry. Okay, there we are. So I'm sure, as Allison covered, and I apologize, I couldn't be there right from the beginning. It is a neurodevelopmental condition. It affects about 5% of the school-age children and is more frequent in boys than in girls. I know Allison and Alex single cause, biological, social, and psychosocial causes are involved, factors are involved. Genetic factors, siblings have twice the risk of having ADHD than the general population. Parents of children with ADHD have an increased incidence of ADHD as well as substance use issues. We will cover the neuroanatomical and neurochemical factors in the next couple of slides, but we'll skip to the neurophysiological changes. Children with ADHD may have some non-specific changes in the EEG that show disorganization that is characteristic of brains of younger children, indicating some delayed maturation. CAT scans usually show no consistent findings in kids with ADHD. PET scans, or the positron emission tomography scans, show decreased cerebral blood flow and low metabolic rates in the frontal lobes of children with ADHD, possibly indicating that their frontal lobes are not adequately performing their inhibitory functions. Other contributing factors can be low birth weight, prematurity, prenatal exposure, lead exposure. The data on food dyes and sugar and caffeine is equivocal. So the neuroanatomical factors, the frontal lobes, which would be the part of the brain right behind our forehead, in the forehead part. This is the area that's primarily involved in the executive functions, which is maintaining attention, planning, problem solving, impulse control, motivation, and voluntary movement. Functional neuroimaging studies have inconsistently documented either no abnormalities or decreased volume and decreased activity in the prefrontal cortex in this part. And the caudate nucleus, this is this part, as well as the globus pallidus. So the globus pallidus and the caudate nucleus are part of the basal ganglia, which are involved in the integration of spatial information as well as movements that occur subconsciously. This explains why children with ADHD may exhibit non-specific or soft neurological signs like clumsiness, motor incoordination, and motor movement overflow at higher rates than general population. So an ADHD kid, when trying to get something, they may overreach, or the movements are just exaggerated motor movements. ADHD used to be called minimal brain dysfunction. in the 50s and 60s. It's speculated that some children with ADHD suffered subtle brain damage during fetal and perinatal periods, which could be due to circulatory or infectious or metabolic, toxic, or physical insults to the brain in those early formative stages. The neurochemical factors, dysfunction in the noradrenergic and the dopamine systems are involved in ADHD, and these systems are the targets for almost all the ADHD medicines, which work by increasing the norepinephrine or dopamine levels in the synapses in the central nervous system by promoting either release of the neurotransmitters and or inhibiting the reuptake, leaving more of the neurotransmitter in this synaptic cleft for it to work on these receptors. One hypothesis is that a dysfunction. How do I go back to the previous slide?
You just click the other arrow, Dr. Nuthi.
Oh, you know what? I'm sorry. I don't see an arrow, but it's okay. I'll let it go. No, it's going forward. Okay, never mind. So one hypothesis is that dysfunction in the peripheral system causes the norepinephrine to accumulate peripherally, which could potentially reset the locus coeruleus, which is the part in the brain, and that's what I was trying to show you by going back, part in the brain that is the primary site of synthesis of norepinephrine in the brain. So if there's a lot of norepinephrine in the periphery, through the feedback loop, it tends to down-regulate the locus coeruleus, and one hypothesis is that that's the way stimulants work, by stimulating the release in the central nervous system. Dopamine is a powerful neurotransmitter that controls the reward circuit located in the limbic system. Dysfunction in the dopamine system is hypothesized to produce a reward deficiency syndrome, which explains the need for a high level of stimulation in folks with ADHD and why they get easily bored. They just need a high level of stimulation to feel satisfied because of the dysfunction in the dopamine system producing a reward deficiency. Psychosocial factors, temperament. Temperament broadly refers to consistent individual differences in our behavior that make us unique. Activity and attention are key elements of temperament. And I'm sure Allison covered other psychosocial factors like stressful events and trauma, and unstructured, disorganized home and school environments. and diagnosis. The diagnosis of ADHD is a clinical diagnosis based on history and observations. We also use parent and teacher behavior rating scales. There are different kinds of rating scales. There are Connors rating scales or Vanderbilt. Then there is the computerized continuous performance test. Basically, in this test, it's a computer program, and on the screen, different letters will show up in different spots on the screen and at different speeds and in different sizes and so on. And what the patient or whoever is taking the test is supposed to do is every time they see any letter other than X, you have to hit the space bar. And anytime they see X, you don't hit anything. You don't hit the space bar. And the computer program will calculate how many omissions, how many times the person missed clicking the space bar when they're supposed to click, how many commissions, which means how many times they actually hit the space bar when they were not supposed to, when X showed up, but they hit it anyway. It will measure the reaction time and so on. And considering all this data, it'll spit out a report that will tell you the percentile score if a person is meeting the score for clinical diagnosis of ADHD. And then, of course, it is very important to rule out other causes and identifying other coexisting conditions. So the differential diagnosis and comorbidities, the first one we absolutely have to rule out is to make sure it's not within the normal range. And that it's not age appropriate. So for a diagnosis of ADHD, the symptoms must be severe, pervasive, and persistent in 2 or more settings. So if it's just only in school, then you have to look at what factors may be causing that, or if the behaviors are only at home, then may be different. So it has to be 2 or more settings. And the symptoms should interfere with, should be severe enough to interfere with social or academic or occupational functioning. And of course, we have to rule out any of these could obviously affect our functioning in terms of attention. I won't go through or vision and hearing problems. Sleep, of course, affects our ability to pay attention. Thyroid problems sometimes can mimic symptoms of ADHD or anxiety, depression. Some seizure disorders we have to rule out if somebody has staring spells or zoning out episode. We want to make sure we rule out absent seizures or temporal lobe epilepsy. Learning disorders often coexist, and so do anxiety, depression, mania or hypomania, oppositional defiant disorder, and of course, drug use, autism spectrum. Treatment, just as we identify the biological and psychosocial factors, we have to address all of those factors. So I'll focus mainly on the biological factors. Pharmacotherapy remains the mainstay of treatment for ADHD. The medications, all the medications for ADHD can primarily be grouped into two categories, stimulants and non-stimulants. Stimulants work by increasing the concentration of norepinephrine and dopamine levels in the central nervous system by promoting their release or inhibiting their reuptake. The stimulants all come in regular or long-acting versions. The regular versions usually, the effects last about 4 to 6 hours. And the long-acting version, the effects last about 10 to 12 hours. These are the pretty much almost all of the stimulants. Methylphenidate, Ritalin is the short-acting version. Concerta is the once-a-day long-acting Ritalin, pretty much. Daytrana is a patch. It's a daily patch. And Quillivant is a liquid formulation. And dexmethylphenidate or Focalin is kind of a chemical modification of methylphenidate. And that comes as regular and extended release. Ritalin or methylphenidate is the most studied stimulant, while dexedrine is the longest stimulant in use. Adderall is pretty much mixed amphetamine salts, the levo and the dextroamphetamine salts. Lisdexamfetamine or Vyvanse, out of all of these, this is the newest stimulant. And this is a modification, a chemical modification on the dextroamphetamine. Stimulants are highly effective in about 75% of kids with ADHD with relatively few side effects. All these stimulants are approved by the FDA for use in children 6 and up, except for dexedrine and Adderall are approved for children 3 and up. The common possible adverse reactions or side effects can be headaches, stomach aches, decreased appetite, which, if severe, could lead to some growth stunting, difficulty falling asleep, racing heart, high blood pressure, tics, occasionally some hallucinations, and obviously the concern about abuse. So clearly it's important to weigh the risks and benefits while deciding to use these medications. Just wanted to mention there was an article in the American Journal of Psychiatry in 2008, which said they looked at 2 studies which documented high rates, about 45% of substance use disorders in the adult population, reflecting high levels of comorbidity. They followed children and adolescents into adulthood. So they found higher rates of substance use disorders in the adulthood. But both the studies concluded that the long established clinical practice of using stimulants to treat children with ADHD does not affect the risk of substance abuse in childhood, in adulthood. Clearly, it's a comorbidity, so there is a higher risk in general. But treating children with ADHD, who have ADHD with a stimulant, really does not put them at a higher risk if taken as prescribed. Also, in terms of the cardiovascular concerns, a systematic review showed that 6 out of 7 studies in children and adolescents did not show any association between stimulant use and adverse cardiovascular outcomes. But the stimulants may increase the risk of sudden death in children with undiagnosed or underlying heart conditions. So that's why it's important to carefully screen the children and adolescents for heart conditions when the medications are prescribed. So often we order a baseline EKG, especially if there's a family history of sudden cardiac death in young people. So these are the non-stimulant medications. Adrenergic agonists, the clonidine and guanfacine, these are the more commonly used ones. Capway is the extended release version, once a day version of clonidine, and Intuniv is the long-acting form of guanfacine. And these medications don't, unlike the stimulants, they don't stimulate the release of norepinephrine or inhibit the reuptake, but they mimic the effects of norepinephrine and norepinephrine in the central nervous system. Strattera is a selective norepinephrine reuptake inhibitor. Velbutrin is a norepinephrine dopamine reuptake inhibitor. Effexor is a selective serotonin and norepinephrine reuptake inhibitor. And the common antidepressants like Prozac, Zoloft, Celexa, Lexapro. Those are all the selective serotonin reuptake inhibitors. Right from here, Velbutrin and down, they would all be considered the almost third line treatments for, the first line would be stimulants. These are the second line treatment for ADHD, and these would be considered the third line. The older antidepressants, like the tricyclic antidepressants, imipramine, amitriptyline, they had been used. They're not used as much now because we have a lot better options, but and also there, a long time ago, there were history of some sudden cardiac deaths in children treated with desipramine. So as a category, this is not much used. Antipsychotics like Abilify and Risperdal are sometimes used in refractory cases and mostly as adjunctive medications to target aggression and mood instability, which often accompanies the ADHD symptoms. Other biological treatments, of course, it's important to evaluate and treat the comorbidities. Monarch external trigeminal nerve stimulation device is a new device. It was very recently, I believe it might have been even this year, approved by the FDA as a standalone treatment for ADHD in children 7 to 12 years old who are not currently taking ADHD medications. It's available only by prescription. I don't have any personal experience with it. It's so new. But what I gather is that the device is the size of a cell phone, and which can be used at home under parental supervision while the child is sleeping. The device generates low-level electrical stimulation transmitted through a wire to a small patch placed on the forehead, sending signals to the frontal area of the brain, which is related to attention, emotion, and behavior. The most common side effects are drowsiness, increase in appetite, trouble sleeping, teeth clenching, headache, and fatigue. No serious adverse effects were apparently reported. The price of this device is a handsome $980. Which comes with the controller unit and a 4-week supply of the electric patches. The refill electric patches are $70 for a pack of 7. So it's quite an expensive treatment at this time anyway. Then biofeedback, EEG biofeedback involves use of brainwave technology, the EEG, to identify and correct thinking and behavior. And it obviously has shown some positive results. The psychosocial therapies, I am sure Allison covered all of this, so we'll skip right through. And the prognosis, the lines are not so clear-cut in real life, but generally about a third of the children fully outgrow their symptoms by the time they're young adults. And another third continue to have as much difficulty in their adulthood as in their childhood. And the other third falls somewhere in between. They have a partial remission. Usually hyperactivity is the first symptom to remit, and distractibility is the last. And nourish and cherish the positive traits of all the children with ADHD. Many people with the disorder are highly intelligent, as you can see here. They are energetic, creative, spontaneous, funny, willing to take risks, and are very resilient. They've gone on to become Olympic athletes, accomplished artists, singers, actors, scientists, and so on. So on that positive note, I will end my presentation. And this is the last slide.
So does anyone have any questions for Dr. Nuthi?
There is a question in the chat that I'll read to you. It asks about what are the long-term effects of ADHD medications, particularly regarding a child's reproductive system and how taking medications may affect children's possible future children.
I don't believe there are really any known, consistently known long-term effects, certainly on the reproductive system. Only if we use antipsychotics, I know that antipsychotics can sometimes increase prolactin level, and that may affect the reproductive system. But I don't believe there's much data about stimulants affecting children in the long term, certainly in the reproductive sense, or going forward generationally, if that's the question.
Thank you. We have another one is, and feel free to send your questions in the chat or just unmute yourself if you have a question. You're welcome to answer or ask your question personally. This one is, have you found a particular medicine to be most effective for preteens with a diagnosis of anxiety and ADHD?
For children with anxiety, and or depression and ADHD, I would lean more towards trying Strattera or even Wellbutrin, mostly if we see more depression and ADHD. Wellbutrin doesn't have as much of anti-anxiety effects or can be used. However, in general, for focusing, none of these medications come close to the stimulants for focusing. In terms of the restlessness, the impulse control, hyperactivity, Tenex and clonidine can also be good options. In fact, they have some anti-anxiety properties. So it depends on the exact symptoms of a particular child. But I would say for anxiety and ADHD combination, I would lean more towards Tenex and clonidine first before going with the stimulant.
Thank you so much.
Mm-hmm. Allison, you want to stop sharing the screen? Maybe we can see.
I can't because you have control of it.
I gave it to you.
Oh, okay. Also on this screen, if there aren't any more questions, these links here, there's a link for resources that Alex and I have gathered together. So you're welcome to go to that link and download, print, read, whatever the resources that we have there. And then there's also a link to do a survey. If you wouldn't mind just giving us a little bit of feedback on what you thought about the workshop. We will be doing another one in January on self-harming behaviors. So we hope to see you guys there.